Hickner. I am the Outreach and Enrollment Coordinator with the Family Health Clinic. For our 25th anniversary, we are interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we're going to be interviewing Deb Mears. So Deb, thank you for joining us, and will you just introduce yourself, please?
Thank you. And I'm Deb Mears, and I have been with the clinic since 1995. So I'm one of the longest members of the clinic, staff of the clinic, and I am support staff coordinator now. I do have my BSN, so I've always been a nurse here at the clinic.
Good, good. And how long have you been here?
I've been here 25 years.
Okay.
I was in NICU before that, and I always thought I was a NICU nurse, but now I know I'm a clinic nurse.
So how have you seen the Family Health Clinic grow in the community since you first started 25 years ago?
We've had a lot of changes. Obviously, there were just 3 of us. There was a nurse practitioner, a nurse, and a front desk person when we first started. We did try to do a lot of community outreach, but at that time it was mostly just letting people know about us and know who we were. We weren't able to do a lot of the services we do now. I did get to do home visits because sometimes we would only have like one person walk in the clinic a day because people really didn't know about us. So we had written for a grant, and I did get to go out to homes. That is something that I do kind of miss now. But we have grown to, we have Barb, who is our insurance navigator. She gave herself kind of a different title, but that's, we've got so many more resources for our client. Kind of started out seeing underinsured, and now what's really wonderful is we can see anyone in the community. We've gotten to the point that we can see underinsured, uninsured, as well as those who have insurance. And before it was more if you maybe needed our services because you had a bill someplace else that wasn't paid and they weren't allowing you to come back, then we would see you. Or if you didn't have any insurance, we provided care at a very low cost. But now it may even be because you're older and you want to come into the clinic because you don't have to drive so far, or transportation's difficult for you. So we just see a much wider range of people than we used to do.
Yeah, so we've seen a lot of changes, right? And
we have mental health services, and like I said, we have our insurance navigators. We have our OBGYN services that we didn't have a specialty in that before. We have pediatric providers. Of course, when we started, we had a nurse practitioner who had actually worked at a clinic such as ours in California. And when she came here, and she was an FNP, so she was very comfortable with all age groups. But now we're just much more able to see a lot of different people. We started out doing physicals too, a lot of well care, which still is the focus of nurse practitioners, is always your health. But we also now can manage chronic diseases and some of those other things that take a little bit more time.
So in the 25 years that you've been here, what would you say is, or a few of the biggest impacts that we've had at the clinic on our community?
Ooh, I maybe I didn't see that question exactly. Let me think. Well, number one, I do think that the health community is definitely better. And something I didn't mention too, when we started, it was a huge collaboration. Like the Division of Family Services at that time, they had gaps of trying to find where they could send their clients, or if they were working with somebody and they didn't have health care now. So they really definitely wanted us here, and we definitely work with them now to see some of their clients, like I said, if they don't have medical care, or for other reasons they need a medical person's advice. Another group that was very involved was the school nurses. And so at all those initial meetings to get the clinic going, we had a school nurse there. There were a lot of children that couldn't, they were sick, they were sending them home, then they couldn't get into doctor's appointments, and so we helped fill that gap. We've also collaborated with the local health department. We had the nurse from the local health department sat on our first advisory board, and she also, maybe she would be seeing kids for vaccinations that were not getting their well checks, and so she didn't really have a place to send them. I mean, I mentioned transportation earlier for the elderly, but also transportation for others is sometimes a difficulty. So we've just definitely made healthcare more available in our community.
Wow, that's powerful. So what does being a part of the Family Health Clinic mean to you?
I actually, when I started here, I had no idea the impact we would have. I had no idea kind of the strength of nurses too. We're a nurse practitioner clinic, and that ability to really fill that gap in the community with medical care. I think I didn't realize that. And I also in town, and there's a couple, I just feel like, tell me what your question was again. I think I got off on it, but I think that our community,
okay.
So many people here willing to help, and now we're a part of that. And I think they were really missing that medical piece. And I know, Barb, you go to some meetings with, the community resources, and I think that medical piece was just so missing. So repeat your question and I'll answer that again.
That's okay. What does being a part of the Family Health Clinic mean to you?
Well, I'm just glad now to be part of the community and be part of that group that's trying to help others here. I just have always felt that way.
Okay. And I think one last question. What's one thing that you want the community to know about the Family Health Clinic?
That we're available for everyone. We had to kind of fight that because we started out, like I said, seeing under and uninsured, and it's available for everyone. You can get education from us. Barb has a wonderful newsletter now that, you can look up wonderful information on that. Everyone can find something here to help them out.
Right. So Deb Mears, who's been here for 25 years and has seen lots of changes with the clinic in different locations and growing. Thank you so much for your time and your involvement with the Family Health Clinic.
Yeah. And we just have to I always say thanks to Jo Brooks because it was her brainchild, and she's a wonderful, wonderful person that saw the need here. Thanks.